Welcome to the webinar. Our topic today is maximizing your results at your chiropractor's office. This 25-minute webinar, followed by a Q&A session, promises to be an informative session designed to empower patients, especially those new to chiropractic care. We will share knowledge and strategies to enhance your treatment outcomes. During today's webinar, you will learn how to communicate effectively with your chiropractors to tailor treatments to your specific needs. We will also cover pre- and post-visit practices that can amplify the benefits of your sessions. Please type your questions in the chat, and we will get to them at the end of the webinar. And at any time during this presentation, you are welcome to call our office for an appointment at 410-210-4562, or visit our website at drcianci.com and click the Book an Appointment button at the top right of your screen. With that, I'll hand the presentation over to Dr. Cianci.
Thank you, Jen. A couple things we're going to go over here today, which has been kind of our format we've done in the other webinars we've done. We're going to talk about what generally happens when a patient comes to our office initially as a brand new patient. We're also going to cover why we do the things that we do. We've been called thoroughly thorough in the past, and we're okay with that. Just this morning, we had a new patient come in, and he halfway through his exam, he's like, wow, I've been to a couple different other offices and no one's been as thorough as you. My friend who referred me, coworker friend, said we would be thorough, and boy, was he right. So we'll explain what happens, but also why and the meanings behind it. One of the things we do, we have some computerized forms we use here in the office so we can get information from the patient. The reason why we use the ones we do is because they gather information quickly and efficiently. Now, the last thing we want to do is skim over everything, but then we want to get as much information as we can. Hence the reason why we use some computerized forms for that. Patients love it because they can answer a lot of questions in a short time. They're not sitting in a room writing things down for an hour. But we want to be as thorough as we can. So that's one of the things we do. After that, generally, at least one of our doctors, maybe as many as 2 or 3, would review some of that history prior to going in and speaking with the patient. And there's some specific topics we talk to face-to-face with the patient after we've had a chance to review everything. But that's kind of how that situation goes. We'll touch on some of the things that are important to know. Certainly, we want to know if a person had any fractures or injuries. There's a number of things we ask that really go further back just than the last few years. We even go back in towards the birth process and things like that too as well. So let you touch on that.
Absolutely. I'm Dr. Julia. I'm one of the doctors in the office, and I wanted to kind of highlight one of the reasons we ask about such a thorough history, even all the way back to your birth or sometimes even pre-birth. And that's because a lot of people in the chiropractic profession consider birth the first subluxation, the first time that their spine is misaligned. And that's because if anyone's ever seen the birth process, most babies are brought out by their neck or their base of their head, sometimes twisted, sometimes pulled, and all of that puts a lot of stress on the baby's spine. And we can see when we see those babies as they develop later on in chiropractic, because they're developing other issues such as colic or other things like that, we can kind of, in our profession, we believe that all ties back to possible misalignments at birth. We also need to know about, for example, if a patient was breech or something like that, or they had a really long, difficult labor. All of that can have an impact on the spine moving forward. Another thing we kind of want to highlight is any falls that the patient has had. And I know Dr. Cianci is going to talk a little bit more about that.
Yeah, I know we were discussing this earlier in the week, and Dr. Julia and I were talking about how at the hospital, babies check their breathing and their blood work and their functioning and APGAR scores and all these things. And certainly that needs to be done, but really the spine and nervous system isn't checked. And hence the reason why we recommend patients do that. More and more progressive patients are doing that. Getting back to the falls and injuries, it isn't just an idea we came up with as far as reaching back into people's histories and asking about falls. The National Safety Council tells us that 50% of us fall from a significant height in the first 5 years of life. Could be off a changing table or rolled off a chair, what we consider usual childhood falls. But again, we want to know that these things happen. And usually if you are an adult now, you may not, maybe your older brother or sister told you that, or maybe your parents told you that, oh, gee, you fell off the countertop or you flipped off the changing table, something like that. We want to know about those things. We want to know about any other accidents, injuries that may have happened with regard to childhood, growing up, things like that. So we also ask a little bit about auto accidents too as well. And again, we even ask, even if it's a minor fender bender, how many car accidents have you had in your life? And even if it's a minor fender bender, we talk about that too as well. So
yes, that's not just us asking about that. There's research showing that even as slow as an 8-mile-an-hour car crash can have an impact on the person's spine. Very often whiplash occurs at as little as 8 miles per hour. There may not be a lot of damage to the actual car when some of these accidents occur, but your body feels those impacts, and that force that traveled through the car went somewhere, and likely it's into you. So that's another big important thing that we like to know about, because you can see the results on the x-ray. Similar to falls, you can see the result of childhood falls on x-ray.
a lot of things we find are very often they're injuries that happened long ago. The body healed it, but it may have healed wrong. And if it stays there for years and decades, oftentimes we'll see the ramifications of it years later. And we'll talk a little bit more about x-ray in a little bit.
Yes.
Again, you're going to say something else?
Yeah, I was going to say, in our consultation, our main goal is to understand what is wrong with you currently and what are the possible causes of that. So we try to understand the full picture of what's going on. We want to also understand whatever is going on, say it's low back pain. We want to know how that is affecting your life. Is it affecting your relationships? Is it affecting your ability to travel, to work? All these things are really important. And we think that all of the questions we ask help us understand the whole picture. And we always like to tell patients, you know, maybe you don't remember a fall you took when you were 2 years old, but your body does. So.
And just this morning, we actually had 2 different new patients, and both of them checked off the fact that they felt like their current condition was affecting relationships. One of them was a 39-year-old. He said, you know, I maybe don't have as much patience as I should with my children. It's just I haven't felt well. And so again, we want to see how that impacts the patient. And again, lifestyle. Dr. Julia mentioned certain activities. I like to golf a lot, and I'm not able to do that. Or I want to take my grandchildren to Disney World, and I don't think I'll be able to do that and walk around and do the whole thing that Disney World requires. And whatever it is to fill in the blank for what a person's activity levels being affected, we find that very often that's what drives them here. They may or may not have symptoms that drove them here, but it's affecting their life and lifestyle. And we want to know what that is, so we can get a person back to living the lifestyle that they want.
Yes. It also helps us create goals for the patient, and then we can work with them to achieve those, which we really get a lot of, I guess, enjoyment out of that process.
Yeah, we get to see people do the things they love, and we love the fact we've had some impact on that. There's a lot more things that are covered in history, but you can obviously we're going to know about the family history and mom and dad, and are they living or not, and what have they died of. That'll be covered by the computerized things, and again, the doctors will review all that initially before speaking to the patient, and then the doctors will get together later that night to review it too as well. At least 2 doctors, maybe as many as 4. So that's one of the things that happens. We also want to know maybe are there some chores or activities around the house you're not able to do. We have a lot of patients who love to garden. Well, if you can't do the things you love, it usually affects you. May even end up affecting your mood because you love to do those sort of things. So after we've gathered that information, we'll call it the history, or what we call the consultation with the patients, the next thing we're going to do is run some tests on the nervous system. And that's our primary focus. We're looking for minor misalignments that affect nerve function. And one of the tests we do in our office actually measures nerve interference, if you will. This is kind of a printout of one. And without getting into too much detail, when you look at an exam like this, you were looking for as much white as possible. And you can probably pick up, perhaps in a camera, that there's some white areas, but there's also a number of other different colors. And I'm not going to get into the details too much. I will tell you this. We tell our patients that you probably haven't had a test done like this locally, because we're not aware of anyone else in the area that has the instruments we have to measure nerve function. But this tells us what's happening inside of a person's body. And we're able to monitor it and measure it. This is something we can repeat down the road to monitor and measure a patient's progress too as well. But that's one of the tests that we end up doing in the office. And that often leads to other things too as well. Then after that, it often leads to, after the consultation, exam. We also do, we talk about the ortho and that sort of thing.
Absolutely. The next thing patients would get are x-rays. We do x-rays in-house in this office. There are at least 2 doctors that look over every set of x-rays, sometimes more than that. We consider x-ray an invaluable way to analyze the spine. When we're looking at an x-ray, we're looking at it through many different lenses. We're obviously ruling out any red flags, but then there are also other things to consider. We want to see the actual structure of that person. We want to see if there's any congenital anomalies, meaning they were born with something that's different in their spine that may or may not explain some of the issues they are dealing with today. Another thing we want to look at is how much arthritis the spine has. So this is kind of a quick model of an arthritis model. This is a perfectly healthy disc spacing, and then as it goes down, this is the in the most advanced stage of degeneration. And when we see that on a x-ray, we may or may not change the way we approach that case. We might choose a different technique. We have many different techniques that we can do in this office. Some are the manual techniques that maybe people have seen before and might associate generally with chiropractic, but we also have much more light force techniques using instruments and things like that. And we'll talk more about that in the kind of the next portion of the webinar. But that's kind of an overview of what we're looking for in x-ray. We also want to make sure that x-rays that we do in office, they're done in gravity, meaning the patient is standing. And we do that because we want to see what the forces of the spine look like, or forces on the spine look like when you are standing up. And that is really important because most people want to remain active. They want to remain mobile. And that is the only way, in our opinion, to measure, to see that is to see what the patient's body looks like when they're standing in gravity.
And with that in mind, we talk about lifestyle and keeping people healthy, mobile, and active. We don't find that it's good to take an x-ray lying down because there's not a lot of activity that's involved lying down. We want to see as Dr. Julia said, the alignment when a person's in gravity. Perhaps in every sport we know of, I don't know of one that you do lying down. And so again, that's a real important factor too as well.
Another thing to consider is most people, if they are in pain, when they're lying down, they're usually out of pain, or at least the pain is reduced. And so we like to see the spine when it's in the position that maybe is causing the most pain, because that will help us understand where it's coming from.
Yeah. And again, we look at the spine as a system. We look at the nervous system. We want to check the entire spine. We don't want to just look at bits and pieces of it. We also do some orthopedic, neurological, and chiropractic testing, checking reflexes and strength. One of the things we find a lot of is very often a person has weaknesses they're not aware of. Sure, we have people come in and say, I don't have the strength in my arm, maybe like I feel like I should, or maybe it's an athlete that doesn't feel like they can throw the ball or hit a tennis racket as strong as they used to. That can happen. Maybe an older person says my legs aren't as strong as they used to. But we go deeper than that. We want to do a variety of different tests. Maybe in the upper extremity, we're checking rotator cuff and arms and hands and fingertips. And then below the waist, we're checking hips and legs and feet and toes. And again, we really have realized, we know this to be true, is that if a person has certain weaknesses, just say it's in the hips and legs in that area, well, they're basically out of alignment when they're asleep. So I'm just lying there. But if there's a weakness there, it's going to torque and twist the spine. So although you think you're not doing anything when you're asleep, very often the spine's out of alignment, has been in that pattern for many years, and leads to other problems. It's really kind of odd for you to say, I just bent over to tie my shoes and I have a big problem. You probably have been out of alignment for quite some time. And the nice thing is that we'll kind of prove that by looking at x-ray and testing. We'll see how much stress has been on the spine, hence the reason why we do all the things that we do. So
one thing I just wanted to add is with both the x-rays, the nervous system testing, and the physical exam that Dr. Cianci was just talking about, we are seeing these weaknesses and these changes in the patient's spines in people as young as, 5 or 6 years old in some cases. We had a patient just this last week that's 8 years old, and you can already see the changes in his spine, most likely from like a developmental, maybe he had a big fall, something like that, like we were talking about earlier.
Yeah, he actually had a pretty difficult birth process too as well, and he's an athlete himself, and again, very often you just groove the pattern in. It's a bad pattern, it's not a helpful pattern. So thankfully, a lot more progressive parents are bringing their children in earlier and earlier because of what we're seeing, long-term patients. So we kind of said consultation, exam, nerve scans, x-rays, orthopedic neurological testing. That's all part of what we do. And really, we do that to gather information. And we always tell the patient, there's 4 questions that we want to work to answer on the first day they're here, or at least gather the information to answer those questions. One is, are you in the right place? Can we help you? That's number 1. We're looking for a lot of different ways for you not to be here so that we quote unquote prove the fact that you need to be here. But we're all trained to do that first. So are you in the right place? Yes or no? We tell you that. The next questions are, what's wrong? Can we help? How long will it take? And how much will it cost? Those are the questions that most people want to know. The information we gather will give us some insight into that. And then after we've gathered that information, that first day, the patient's given some recommendations for home, and then they're scheduled time to come back generally the next day. And we will tell them for sure that next day, those 4 questions: what's wrong? How long will it take? How much will it cost? Is this the right place? We answer those 4 questions. So that's kind of part of the quote unquote first visit. And I told you a little bit about what would happen that following visit when we do the explanation of the findings. And as Dr. Julia was mentioning before, all of that gathered information may give us some insight into how we're going to lay out the care plan. I'll tell you this, at least 2 doctors, maybe as many as 4, will review your x-rays, your history, all the nerve scans, everything we've listed here as well. And that may dictate what sort of care plan we use. Dr. Julia alluded to some manual techniques, kind of traditional chiropractic techniques, which we're all excellent at and getting great results with. Hands-on adjusting, we certainly do that. We also have a number of different instruments here. Some cases don't require hands-on adjustments, old-fashioned chiropractic adjustments. We have small instruments in the office that we sometimes use. This is one of them here. It's kind of a spring-loaded instrument, very gentle, very easy, but it kind of gently taps vertebra back in place. And it just gets placed along the spine, and we make an adjustment to a person's spine, various levels. Maybe if you have someone who's nervous, or maybe if you have someone who's osteoporotic, meaning osteoporosis, maybe this might be an instrument that's used to make alignments with patients. We also have another instrument here. I'll just show you. It's basically a similar type object, but it more runs on a cord, and it's just gently placed against the spine, and things are just gently tapped back into place. Works well for certain conditions, works well for patients who maybe don't enjoy the popping and clicking, or maybe a particular case, because of the history exam and x-rays, we say, one of these instruments is going to be the better way to go. But either way, we have a variety of different techniques and a variety of different doctors and different specialties to go ahead and take care of those things. So that's kind of, and I know part of our summary, if you will, for that information is our library. We have a video library.
Absolutely.
Yeah, we have a video library. Perhaps we find a person's had a bad pattern in their body for a long time, it needs to change. We have an area we call our spinal rejuvenation center, where people do exercises to help change the patterns that were there, and again, really target the area that we said the weaknesses and how important they were, to really target those areas. The average gym workout doesn't target the things that lead to spinal problems. They have, number one, you'd have to find out what they were, and number 2, you'd have to target those areas to get that strength back. We have triathletes come in here, and yeah, they're in very good shape. We find weaknesses in them all the time. College athletes, doesn't really matter. An 8-year-old had weaknesses the other day, so it can happen really to anybody, athlete or not. So anyway, I think we've covered most of what we generally wanted to cover. Jen, did you have questions come in that you wanted us to answer?
We do. So thank you for the presentation, Dr. Cianci and Dr. Julia. We have some questions that have come in. For our audience, you're welcome to type in your questions in the chat, or if you are watching the replay, you're welcome to contact our office with your questions and we'd be happy to answer them. So first question, you wear name tags in your office. Why do you do that?
Yeah, we wear these name tags. I'm part of extension faculty for one of the largest chiropractic universities. And part of it requires a training program, if you will, for doctors. And so we have a training program that doctors go through here involving neurology rotation, radiology rotation, and there's a management rotation. So we just want patients to know who the doctors are, and hence the reason for the name tags, and hence the reason why there's multiple doctors here. We also bring in student doctors too as well in various stages of their training for the same purpose, for training them to get out in the field and maybe just to start seeing patients themselves after graduation. So that's the reason for the name tags.
That's great. Thank you. Next question. My last chiropractor didn't take x-rays. Were they supposed to? And why do you guys take x-rays?
So x-rays have been around since about 1895. Yeah, and it's been used in chiropractic offices since the early 1900s. And so we, like we said kind of earlier in this presentation, we think it's pretty invaluable to getting the information that we need in order to make the best, get the best results for our patients. Pretty much any specialist with their first line of, you know, imaging would be x-ray, and that is kind of where we fall. We're in that first level of specialty, and that is kind of our main reasoning for it. But I don't know if you have anything to add to that.
I would add to that. It's been around since 1895. It's been in private practice since the early 1900s. It doesn't matter whether you go see an orthopedic surgeon or a neurologist or a neurosurgeon. It won't be very long if you have spinal type complaints. If they're going to order x-ray, we want it in-house so we can do it right away. We also want to be able to send it, meaning if we will have at least 2 doctors, maybe as many as 4 review the x-rays, but we also want to have the ability to send them. If we do need to send them to a radiologist, or we have patients who start maybe care here and they're relocating to a new state, in about 5 seconds, we can ship their x-rays anywhere we want, or any way they want us to. And that's, I say around the country, it's really around the world. We can send them anywhere and get them evaluated by someone else. Makes it easier for transitioning should a person relocate or retire to a new area. And we've already covered the clinical aspect of it. So I don't know why someone maybe wouldn't use them. I just know that we wouldn't, except there's a couple
I was gonna
reasons
say, the
why
only
we
reasons
wouldn't.
we wouldn't take an x-ray of a patient would be if they are pregnant or if they are very, very young and there's no actual trauma that they are, you know, dealing with. So
Yeah, we have a patient yesterday, a new patient, who's ready to deliver in about a month, I would say. Well, obviously, we're not x-raying her. And again, children, if it was a recent trauma, that might be a reason for it. But, you know, we think x-rays, it's imperative, at least as far as our analysis goes.
absolutely, yes. And that helps us. Otherwise, we have really no idea where along this kind of, these different phases of degeneration or arthritis, we have no idea without seeing the spine, what someone's spine looks like.
Yeah, we had a 15-year-old with arthritis showing up, starting to show in the spine.
Exactly, yes,
Got x-ray in our opinion.
absolutely.
Great, thank you. Next question. So you mentioned that more often than not, spinal problems start in childhood. Will your clinic treat children? And what is the youngest age that you will start treatment?
Go for it.
Okay. So yes, we see children. I'd say we see children, some children at least every day. I've had parents who maybe have been under chiropractic care. I've had them bring their children right from the hospital here. So Dr. Julia was actually adjusted.
I was adjusted.
She was adjusted right at birth.
Of being born, yes.
Yeah, so the age doesn't matter, meaning we don't shy away from that.
It changes the way you approach it. You
Yes.
obviously are not using the same techniques you would use on an adult in a child, but
Again, the more and more, as I said, progressive parents are bringing children in younger and younger, thankfully. And, but we start seeing children soon after they're born, really. Like I said, we've had some bring them right from the hospital here on the ride home. So, sooner the better, because again, the hospital did everything great, wonderful, and fantastic and thorough. But again, the nervous system and the spine wasn't checked. We kind of know that.
Great. Next question. Would you be able to explain this part about the first day? So there's an initial evaluation, x-rays, and nerve testing, but why is there not treatment the first day?
we believe in our process and needing to look over, take some time away from the patient in order to fully gather our thoughts and gather our recommendations. We would never want to not put that time in because we think the patient deserves that kind of effort and
Analysis. Yeah.
Yes.
I would also add that most doctors' offices are very busy. I'd rather make important decisions that are going to affect a patient's life and lifestyle. I'd rather do it after patients have left for the day, after we've had time to sit down and look at it. Yes, we take that history very thoroughly, computerized portion of it, and then the verbal portion of it. But our doctors are instructed to, if this is the history, to flip it over and don't look at it, and then go do an exam. That way you're not influenced by it. That way you're not likely to go, we got this person figured out. We don't have to, we talk to them, that's enough. We want to kind of separate it. And often too, the doctor, if there's a couple doctors reviewing things, one of them wasn't in the exam room and didn't maybe take the x-rays. So you're kind of coming in with someone who knows the background and the details and someone who isn't. We feel it's a more thorough way to analyze things, because again, the doctor who didn't do the exam and wasn't in there on the consultation is coming in totally no influence. Their mind is clear. We find it's a great way to combine the person who saw the details and the person who didn't, bring it together. And it's just a better, more thorough way to do things. We might make some general recommendations. We might say, hey, use some ice packs at home. That's pretty regular. We find that to be helpful. But again, we want to be sure we've reviewed everything before we go ahead and make recommendations to the patient, or really give out any care prior to having to sit down and look through it and be thorough about it.
Great, thank you. Our last question. How long should a person set aside for their initial evaluation and x-rays?
In our office, we say typically about an hour to start with the paperwork and finish with the exam and x-rays. You can have paperwork sent home beforehand as well, and that can speed that up, but about an hour is about what we recommend.
Yeah, we see a lot of families here. So oftentimes if the husband is a patient, he says, bring my wife in, sit down and see her. We'll say, hey, here's the paperwork. I want you to take this home to her. It'll save her a little bit of time in the office. But I would say that an hour is a good time frame to set aside for that.
Great. Now that's all the questions we have for today, but Dr. Cianci and Dr. Julia, do you have any final remarks before we end the webinar?
I don't. I think I've covered most everything. Do you have anything? We've covered pretty much what we plan to.
Yep.
Great. Well, thank you everyone for joining us today. This webinar recording will be available to rewatch within 1 week. Please call our office for an appointment at 410-210-4562, or visit our website at drcianci.com and click the book an appointment button at the top right. Thank you for joining us today and have a great day.
Thank you, John.
Thank you.